What is the latest chordoma research? Imagine a rare type of bone cancer that develops from leftover tissue from the notochord, which is a structure present during early development. This cancer, called chordoma, usually appears along the spine or at the base of the skull. Because it is so rare, scientists are working hard to understand its biology and find better ways to treat it. Recent research is focusing on several exciting areas. Scientists are studying the genes and proteins in chordoma tumors to see what makes these tumors grow. They are especially interested in pathways like mTOR and STAT3, which are involved in cell growth and survival. By understanding these pathways, researchers hope to identify new targets for drugs that could stop the tumor from spreading or shrinking it. They are also looking for biomarkers, biological signs, that can help predict how a patient will respond to treatment or how aggressive the tumor might be. Another promising area is immunotherapy, which uses the body's immune system to fight cancer. Researchers are developing vaccines that target a protein called brachyury, which is found in almost all chordomas. A clinical trial is testing a vaccine called G6301 combined with radiation therapy. The goal is to boost the immune system so it can better attack the tumor, especially in cases where surgery or radiation alone might not be enough. Targeted molecular therapies are also being explored. These are drugs designed to block specific molecules or pathways that tumors relying on to grow. Some studies are testing inhibitors that target cell cycle regulators like CDK4 and CDK6, which are important for cell division. Although many of these drugs are still in early testing phases, they show more promise than traditional chemotherapy, which has limited effectiveness against chordoma. Immunotherapy drugs called checkpoint inhibitors are also being tested in clinical trials. These drugs, such as nivolumab and ipilimumab, help the immune system recognize and attack cancer cells. Trials at centers like the University of California, San Francisco, are exploring how well these drugs work for chordoma and similar tumors that may resist other treatments. Patients and their families are playing a vital role in advancing research. Support groups and advocacy organizations help raise awareness and encourage participation in clinical trials. This collective effort is essential for discovering new treatments and improving outcomes for those affected by this rare cancer. Overall, current research on chordoma is moving toward a more personalized approach. Scientists are combining molecular studies, immunotherapy, and targeted drugs to develop treatments that are more effective and less toxic. While surgery and radiation remains the main treatments today, these ongoing studies aim to provide systemic options that can help control or even cure the disease in the future. If you or someone you know is dealing with chordoma, it is important to work closely with healthcare professionals who can guide you through the latest available options and clinical trials.